been probably the most rewarding thing that we've ever done here. It's changed how I see my patients, it's changed how I see pharmacy, and some of my patients, it's changed their lives. It truly has.
When we have to write prescriptions, we send them to a local pharmaceutical facility called Dispensary of Hope. And they work with us very well in providing free medications for our patients.
Overall, in the 4-year period, we have filled for over 1,800, probably closer to 1,900 patients. By the time the next month rolls around, it'll probably be close to 2,000 patients. 4 years.
So I designed a patient discharge counseling program at our hospital in which the pharmacists are ultimately responsible for counseling them like you would in retail setting on all new medication.
We have an endocrinologist comes to our clinic a half day once a week. That is one of our best diabetic resources we have.
Was give them access to a dilated eye exam. That was offered with all of our patients who came and had one visit with us. And some of those folks either had never had one or it had been years since they had that. We have one patient who, every time I see her, I smile and I say, I want to grow up to be you, because she woke up one day and said, I'm not going to live like this anymore. This is ridiculous. And she, in a period of time, lost in excess of 50 pounds on her own. She's changed the way she eats daily, and now she's changing the way her daughter eats, because she lives with her and her grandchildren, and she's changing the way they all eat. And I say, Miss Deb, I want to be you. I don't know how you do this. And she's like, all you do is do what you got to do. She's a little niggle. For the most part, all bread, no sodas. I mean, she said, if you want to feel good, you have to do this.
Their teaching ability, their knowledge, for one, they were very good at teaching medication administration. For one, teaching lifestyle change.
I did see one patient, particularly when I was in one day and the pharmacist was working with this patient. And I think one of the things that most surprised me was how engaged they were in the moment, hanging on every word. That even though they could maybe only take 2 pieces of it back and implement it, or 1 piece, they still wanted to know. They still wanted to try to figure out how that fit in this discombobulated life that they deal with every day.
They bring me in at times, and I can talk about my situation. They look over what my numbers, and just being able to talk to them, and that's another thing. You need to, or for me, I need to have a place like this, in order to talk to somebody. You really feel like you're alone when you have disease.
And that's what I hope that we're known for. Not only just giving patients their medications and those that need it, but it will help you. Maybe it will help you do better in life.